And this is the parallel session 5, celebrating the World Antimicrobial Awareness Week, preventing antimicrobial resistance together. So I hope you're in the right room, because the next door is about mental health. This room, I must really apologize for all the mix-up sometimes. Here we have, they got the room numbers sort of mixed up, crossed, but now they put in the numbers so that we go to the right room. All right, welcome back. I hope you had a good lunch. This session, as I said, is parallel session 5, celebrating the World Antimicrobial Awareness Week, preventing microbial resistance together. And it's my pleasure to announce that Kun Ellos Lodzeni, Vice Chair, IAPO, and founder, AMR Patient Alliance Africa chapter, is going to be the moderator. And today we have two speakers. One is Dr. Nithima Sumpradit, Senior Pharmacist, Food and Drug Administration, Ministry of Public Health, Thailand, and Kun Marimel Lamsin, Vice President, Internal Kidney Transplant Association of the Philippines. You can find their full biographies on the 4th Asia Pacific Patient Congress page on the IAPO website. And as always, we invite you to submit your questions to the speakers, whether you're here in person or online. And if you're online, please send your questions via the Q&A tab by the virtual stage. And now I pass the floor to Kun Ellos.
Good day, participants. Good day, colleagues online. This week we've been celebrating antimicrobial resistance. And today is the final day for that. According to WHO, antimicrobial resistance is one of the 10 global public health threats facing humanity. Imagine a situation where humans, animals, plants, all of them give resistance to all medicines that are meant to fight the various ailments which we have. It will be disaster. According to statistics, globally, in 2019, 1.27 million people died due to AMR. And the projections are that by 2050, we are going to lose almost 10 million people. This is a situation which all of us must be worried. AMR is not a disease. It is caused by us, humans. That being said, it is us humans who have solutions on what we are supposed to be doing. I have presentations from the regulatory organization and a presentation from the patient perspective. So at this juncture, I would like to call Nithima to come and make her presentation in as far as the regulatory perspective is concerned with AMR. Welcome, Nithima.
Thank you very much for having me here today. It's a very good opportunity to celebrate the Antimicrobial Awareness Week. May I have my slide, please? Okay, I think I will start with the overview of what we have done in Thailand about the AMR. As you know that in 2014 is a landmark that the WHO have an agreement to have the global action plan on the AMR. And since then, Thailand have developed our first national strategic plan on the AMR. And then in 2017, from then we start implementation of our plan. And also along the way, we have conduct the evidence and develop the M&E platform to evaluate the progress and also engage the wider stakeholder. And right now we are in the last phase of the plan implementation and going to develop the second plan on the National Strategic Plan on the AMR. For the Antimicrobial Awareness Week, we have celebrated many years ago, and last year we just have the high-level participation that 3 ministers from the Health Minister, Agriculture Minister, and Environmental Minister joined together on the same celebration and emphasize the importance of the AMR in each sector. And this is just an overview of how the outcome of our implementation. You can see that we are success in reduce the consumption of MR in human and in animal. And also the capacity of MR management in Thailand have been improved over 5 years due to the joint external evaluation for the IHR conducted by the WHO. However, we are not success in bringing down the rate of antimicrobial resistance yet. That may take some time. And the increase of public awareness on AMR kind of increasing, but a little bit not achieve our goal yet. So next I'm going to give you some example of the initiative that we collaborate with the prescriber and also with the patient to bring down the consumption of antibiotic use in Thailand. We start this project we call Antimicrobial Smart Use back far away in 2007. This project mainly aimed at to reduce unnecessary use of antibiotics in 3 common diseases like in a common cold, in acute diarrhea, and in simple wound, which is in Thailand. Traditionally, we have the norm that if you have a sore throat, you may take amoxicillin, and if having a diarrhea, may take norfloxacin, and the wound may take digoxazolin. So we need to change this norm. So we introduce this intervention. And along this intervention, we have conduct as a research, action research. So we measuring over time about whether whether this intervention have been effective to bring to reduce the prescription among prescriber, among physicians, and also we also monitoring the impact on the patient outcome. We want to make sure that not prescribing antibiotic for these 3 diseases won't harmful for the patient. So, and we found that after patient didn't have antibiotic for these symptoms, they come back and we make a telephone call, and they found that over 90% of patients get recovered despite not having antibiotic at all. This is like the confirmation. And right now, this intervention was adopted in terms of the national policy by the Ministry of Public Health, and this graph just showed the reducing trend of antibiotic prescription in the hospital and also in the primary care unit. But in terms of, this is I present in terms of supply side. What about the demand side, the patient perspective? We also have intervention for that. We need to understand that patients, when they are healthy and when they are sick, are kind of totally different emotion. In terms of the healthy people, you can give any kind of information. But if they are in the sick mode, if they have the sore throat, they have a lot of worry, a lot of anxiety. What we have done is we provide the relevant information to them. And if they are success in recover by not using antibiotic for the common cold, this experience will become their mastery experience and will be to determine the next behavior when they expose the same disease. And what we have done is we just provide the relevant information to them. What kind of relevant information? Mainly they would like to know what's wrong with them and when will they get recover. So this graph will present, was presented to the patients to make them understand the nature of the disease, that in the first 5 days may be like a lot of symptoms, and after that it will be less and less. So they kind of understand the progress of the symptom. The second thing is, what about the pharmacy? Patients usually come to the pharmacy store when they have the sore throat and request for the antibiotics. And this is kind of initiative at the pharmacy that we have some self-diagnosis tool at the pharmacy, educate the patient while allow them to make their own decision whether or not they should take antibiotic. We educate them in terms of encourage them to look at their sore throat using the flashlight that we provide and compare between bacterial infection and this is the viral infection, which one they kind of think they are infected. So this kind of tools is very helpful in terms of patients can make their joint decision with the pharmacy, community pharmacy, and then they end up that they agree that they are not having the bacterial infection. So they kind of agree not to receive antibiotic. And we also provide the alternative medicine in terms of herbal medicines or some vitamins to relieve their symptoms with the recommendation. I would like to say something about the trough or the flashlight that I mentioned. Traditionally, when we start this project, we observe that many hospitals and many primary care units, they have the traditional one, which is the light is reddish yellow. And when you use this kind of flashlight in the throat of the patient, it looks redder than before. It looks like more infected. This is kind of mislead the diagnosis. So we encourage to change the flashlight into the white or the natural light that help the accuracy of the diagnosis. And once the patient kind of go through this process, and then they can be recovered with the common cold without antibiotic, that we have that experience, and this experience can be transferred to others people in the community. They can be like the educator, the community educator, health educator. And also sometimes they generate their own poster, use the picture of their own family to make a campaign for not using antibiotic if not necessary. This is just an example. So this is a kind of initiative that we start earlier. And then we have the AMR national plan. And under the AMR national plan, I would like to highlight that we also do another thing that I didn't show in the slide. We have strengthening our regulation. We conduct the antibiotic reclassification as well. In many countries, including Thailand, antibiotic is not a prescription drug. But along the way, we try to set the priority. For example, right now we are success to have antibiotic for injection and anti-TB drug to be prescription only. And right now we are in the process of revising categories of oral antibiotics. Some oral antibiotics should be prescription only because if they are last line or very important one. But some should be still available at the pharmacy that can provide basic care for the consumer. So we try to balance between access and access to the antibiotics. I think this is like all information that I would like to share. And if you would like to looking for additional information about the antibiotic smart use project, you can find in many resources. Okay, thank you very much.
Well, thank you very much, Nithima. At this point, we'd like to hear a patient perspective with regard to AMR. So let me call Marimel Lamsin to come and give her presentation. Marimel, you are floor.
Good afternoon, everyone. Thank you, International Alliance of Patients Organization, for inviting me to be a speaker in the 4th Asia-Pacific Congress. My topic for this session are patient safety and importance of safe antibiotic. Why do you think patient safety is a global health priority? Why patient safety is part of the infection prevention and control? First, let's define what is patient safety. Patient safety is a healthcare discipline that emerged with the evolving complexity of healthcare system and the resulting rise of patients' harm in healthcare facilities. Why does patient harm occur? What is the patient safety issue and concern, or the so-called burden of harm? Do you know that every year, millions of patients suffer injuries or die because of unsafe and poor quality healthcare? It's alarming, isn't it? Number one in patient safety, or so-called burden of harm, is medication. Medication error was the most common patient safety concern identified. Errors include administering the wrong drugs to the wrong patient, administering drugs that had passed their expiry date, giving the wrong dose, a continue of drug for unjustified period of time, or drug omission, failure to administer prescribed drug. As per WHO, globally, as of 4 inpatient are harmed in primary and outpatient healthcare, up to 80% are harmed is preventable. Next is healthcare-associated infection. Post-surgery wound infections and urinary tract infection due to healthcare professionals not adhering to sterilize technique were the healthcare-associated infection identified. Surgical errors and post-operative complication notable among the surgical-related patient safety concerns were the retention of foreign objects like gauge. In some instances, surgical errors resulted in mortality. And other are diagnostic errors. Errors were perceived as common, wrongly diagnosis a patient as having tuberculosis when they had cancer or vice versa. Laboratory and blood testing error, incompatible blood transfusion errors were reported. Common laboratory blood testing errors include performing wrong or unnecessary blood investigations and issuing wrong laboratory result. Next is fall injuries. These involve patients falling from beds or trolleys. And communication errors use verbal abuse and or rude behaviors toward patient and failure to communicate clearly to patient about their disease and treatment were identified. And patient identification errors. The lack of formal patient identification system was reported. This was considered particularly problematic since people often have the same or similar names. A major consequences of this was the risk and incidence of patients receiving the wrong treatment or procedure. Now, let's move on to the importance of safe antibiotics. Antibiotics help fight bacterial infections in the body, such as pneumonia, urinary tract infection, skin infection, sexually transmitted diseases, and many more. However, they are not useful to treat viral infection, such as colds and flu. The use of antibiotics for viral infection may lead to unnecessary side effects. These are the proper use of antibiotics and safety. Take the antibiotics regularly at ordered times and finish the entire amount of medication. When using antibiotics, it is important that all doses are taken regularly and finished at the ordered time. By taking all the doses that are ordered, the antibiotic kills all the bacteria related to the infection and reduce the chance of the remaining bacteria to form resistance to the antibiotics. This decreases the chances of the infection for returning. Taking antibiotics too often or for the wrong reason can change bacteria so much that antibiotics don't work against them. According to the World Health Organization, WHO, it is important to finish all the antibiotics prescribed even if you start to feel better or have decreased symptoms. This will help to ensure that the infection has been fully treated. Next, do not share antibiotics. Antibiotics should never be shared. This is important because sharing the medication may lead to complication as the antibiotic may not be appropriate for the other person it is given to. The antibiotic that has been ordered to specific to that person and the type of infection being related. Next, ask question. Ask question when you are unsure about how and when to take antibiotics. Ask what common side effect to expect and what type of food should be avoided when taking antibiotics. As your healthcare provider, if the antibiotics will interact with the medication you are taking. And what effect does antimicrobial resistance have on a kidney transplant like us? Resistant infection can be difficult to us. It's not impossible to treat, especially if the bacteria have already developed the ability to resist drugs and continue to multiply. This is why a urine culture sensitivity test for urinary tract infection is required prior to the beginning of the medication. And what are the risks of health-associated infection to kidney transplant? Health-associated infection is a major cause of morbidity and mortality among kidney transplant recipients. And it may not manifest typically infection signs and symptoms over time. CMV or cytomegalovirus is an example of common virus. Once infected, your body retains the virus for life, which can be fatal. I would like to end my presentation by saying that medicine are indeed an essential part of medical field. Still, the human side of disease and illness is often forgotten and ignored. Thank you.
Thank you very much for the elaborate and the informative presentation. I'm sure we have all seen the do's and don'ts if we have to arrest AMR. Otherwise, if we relax, we put ourselves in danger. Now I want to open the floor to members in case you have questions to the panelists. The floor is open. Do you have any questions online? If not, while we are waiting, my question goes to Lamsin. How do you measure societal people's compliance to the various don'ts which they are supposed to comply, if at all we have to maintain the efficacy of the antimicrobials?
There are certain laboratory tests for CMV.
The other question goes to Nithima. Are there any major challenges which we encounter as you try to arrest the negative effects of antimicrobials?
Could you repeat again?
What are the challenges which you face in your day-to-day work in the implementation of the antimicrobial national action plan?
The challenge of the implementation of the National Action Plan, I think there are many of them. The first one is about the data fragmentation, because when we would like to implement our plan, we need to have a good data. We need to understand the situation. And so far, in the past, we have some information in the health sector and some in animal sector, but in environmental sector is kind of very rare, and data are fragmented. And second challenge is about engagement of the wider stakeholder, because MR is a complex issue. When you try to communicate with policymakers to the people in the non-health sector, it's very challenging.
Thank you very much. I'm being informed that the third speaker, Asawari Sathaye, who is Director of Communications and Patient Advocacy, an organization of pharmaceutical producers of India, did present her a recording. She's not here physically, but there's a recording which the technicians will play. Thank you. We give you the floor.
Good afternoon to everyone present at the IAPO's 4th Asia Pacific Congress. I am Asawari Sathaye, Director Communications and Patients Advocacy at OPPI, the Organization of Pharmaceutical Producers of India. My apologies at the outset that I couldn't be present in person for this event, and I thank the entire team at IAPO to have helped me out and share my thoughts via the virtual mode. I will be speaking today on the antimicrobial resistance, a rising menace in India. Now, India has been referred to as the AMR capital of the world. India is the pharmacy for the world and also notably the largest consumer of antibiotics. With a high burden of bacterial infections, a lack of universal health coverage, and limited access to health services, Indians rely on the costly private sector, including unlicensed informal providers and self-medication for most of the illnesses. Now, while on one hand, the emergence of newer MDR organisms pose newer diagnostic and therapeutic challenges, on the other hand, India is still striving to combat old enemies such as tuberculosis, malaria, and cholera pathogens, which are becoming more and more drug resistant. India is the world's largest consumer of antibiotics. The erratic consumption patterns of antibiotics, such as the OTC purchases, the consumption without prescription, has led to antibiotic misuse and its ineffectiveness. For this purpose, it is vital to build awareness and to understand better the ill effects of such practices. The injudicious use and the rampant availability of antibiotics as OTC has led to India having the highest drug resistance index among the low and middle income countries. Furthermore, the usage of antimicrobials in agriculture has also led to the increase of superbugs in the food chain. Now, I want to point out to two findings that you can see on my screen right now. The first one is the ICMR report finding on resistance to epinephrine, which is used to treat infections caused by bacteria E. coli, which has increased from 14% in 2016 to 36% in 2021. The second finding is on what we now call as the silent pandemic. During the COVID-19 pandemic, this set a new momentum, which we now term as silent pandemic, which is of searching for antibiotics or medicines on Google, and a possible increase in antimicrobial drug consumption thereof. But while we are trying to put together what really is the happenings around AMR, we need to also understand who is the target audience for this excessive antibiotic usage. According to a survey, the psychographic profile of a confident individual with access to medical knowledge and influencer network is the target audience that we are looking at. So these individuals are very active, in taking care of their own health. They value convenience, time, and money, and in that specific order. They are proactive, they are aware of specific health issues, and they're seekers of information. They are also self-reliant, and they like to go and self-monitor in relieving minor symptoms or conditions. But why is AMR so prevalent in lower income or lower to middle income countries? The first challenges that we really need to look at are challenges faced by HCPs or doctors in fighting AMR. The high patient burden on the doctor, the very low doctor to patient ratios, no time to counsel patients on antibiotic usage, poor patient compliance and follow-ups during the antibiotic therapy, lack of proper ecosystem to support the doctor. Antibiotic usage is also termed as a tragedy of the commons. This is because antibiotics are a common resource. They are overexploited by individuals acting in their best interest, but unfortunately, to the detriment of all. Many a times, these individuals do not even have the economic wherewithal to go and buy the entire strip of antibiotic. So most of the times what happens is these strips are cut, dosages are given per day, and therefore there is no time to counsel the patient either by the HCP or at the pharmacist's end. There is also this poor patient compliance because patients may not necessarily show up for the follow-up therapies. Similarly, rational doctors motivated to attain the best outcomes for their own patients will prescribe antibiotics irrespective of the level of antibiotic resistance. And this is owing to lack of proper diagnostic modalities for identifying the pathogen and its drug susceptibility. So what we really understood in this whole process is that most patients and consumers are not able to differentiate between categories of drugs. So the term antibiotic is well known, but it is little understood. There's absolutely no awareness regarding the differentiation of OTC drugs and prescription-only products among consumers and patients. So categories like painkillers, antibiotics, antacids, tonics, contraceptives, these are well known. But there exists low awareness regarding the types and the brands under these categories, the relief that is given by antibiotics, the need that they need to be prescribed and not, taken over the counter. That you have to complete the dosage to actually understand and go through the final results. So familiar brands are deemed safe, almost quasi-OTC. But pharmacists do not ask for prescriptions while dispensing antibiotics. Similarly, within the hospitals, an unscrutinized and irrational use of higher antibiotics drive the development and spread of this resistance. Now, so what is the solution to all of this menace, right? One way, one possibility that we see is only when not only the HCP, but also the patients are made aware of what is being prescribed to them and the side effects of the drugs that they will be using. So to get this into act, there was a need for a very simple, understandable and actionable step to counter this confusion and beat AMR. But before talking about AMR, it was important that we spoke about antibiotics in itself. So on the 13th of April 2017, OPPI launched a partnership with the Ministry of Health and Family Welfare in India and formally launched the Red Line campaign. The campaign pushed for all prescription-only antibiotics to be marked with a vertical red line on the packaging as a mark of caution that these antibiotics should only be consumed on doctor's advice and that the patients need to complete the full course prescribed by the doctor. So a simple visual tool of a red line or a lal lakir in Hindi was helped to identify antibiotics. So this campaign, the Lal Lakir campaign, the objective of the campaign was to stop the misuse of antibiotics. It was to amplify awareness around the repercussions of buying antibiotics over the counter, not only among patients but also healthcare professionals. The term medicines with red line or the red line was assisted and helped the users in distinguishing antibiotics from other medicines. How did the campaign really play out? Now, one, it helped the government of India in raising public awareness about improper usage of antibiotics. It pushed people to avoid using any medications with a red vertical line on the label. At least people were asking the pharmacist or the HCP, what is this red line all about? It sort of at least pushed and prevented the unwarranted prescription of over-the-counter sale of antibiotics. The photo that you see on the screen is of the Chennai Declaration, where the National Action Plan on Antimicrobial Resistance was adopted. The next screen that you see here is just a quick image capture of how the campaign was covered across different tier 1s and mainline media within India. In fact, the photo of the Indian Prime Minister, Honorable Shri Narendra Modi ji, where he has also mentioned this program in his talk, Man Ki Baat, which is a radio talk hosted by the PM, where he picks up topics that are very important and relevant. Now, while the campaign was very successful, there were, of course, a few learnings from this campaign. One was this campaign was very easy to understand and implement, and therefore People found it easy to ask questions. People were inquisitive when they saw this red line on posters and actually on the packaging. But there were also some barriers that we picked up. The first barrier was that most of these packs or the packages were cut, like I mentioned earlier, before being dispensed to the public. As many patients did not, one, necessarily require the entire dosage, so they were only prescribed, for example, for 3 days or 5 days, and only those many of the tablets were cut out. That dosage was cut out from the package and shared with the patient. So that sort of completely defeated the purpose of putting a red line on the packaging because the patient could never really see the entire packaging. The second issue that we saw or we encountered was that red is also associated with auspiciousness in the country. And it does not necessarily only signify danger. So when there was a red line on the package, not many, there was some set of patients who did not necessarily think that this was a sign of danger, a stop, no go, ask questions when you see the red line. This did not occur with them. But at the same time, we can definitely say that this sort of a campaign created a lot of patient awareness. One, it was necessary to make a shift in the social behavior with respect to buying medicines without prescriptions and buying medicines over the counter. So this sort of amplification of knowledge really helped. Similarly, when we looked at the WHO's survey, which was a multi-country survey, including India, the survey sort of showed that almost 64% of the people surveyed knew about AMR. They knew that AMR could affect them, but they did not understand how it could affect them, nor could they know, or they were not able to understand what could they do to address these issues. So such campaigns, I feel, at that point of time and even today, they continue to be relevant because these are going to only ensure that we are engaging better with the patient. We are able to make sure that the patient has amplified knowledge and access to knowledge when it comes to their own health. And we are able to also close some of the gaps which contribute to this phenomenon. So something definitely to think of. But with that, I would like to end my presentation for today. And I thank all of you all for giving me the opportunity to really come here, present in front of you all, and share the campaign that the Government of India had put together. So once again, thank you to the organizers for having me over, and I hope we can stay connected. Thanks, and I hope you have a wonderful conference ahead. Thank you.
Just give a hand to Asawari. Asawari has raised some important questions. The question which I've picked is the one which says, why is AMR very prevalent in low and medium income countries? And then the multi-country survey by WHO. All these are pointing at the human being and us as patients. The buck stops at us as patients, our communities, as well as the carers. So, the issue is, what are we going to do after Bangkok when we go back to our homes? What is it that we are going to do? Before I conclude the presentation, let me also give the floor in case there are some questions which people want to put up. Still, we haven't received anything online. Okay. It seems everything is clear now, so I can make my concluding remarks. From the presentation, what we can see is that the time to act is now. We don't have to wait. The AMR burden in all our countries, globally, and especially us in the low and medium income countries, is grave. and we have to act. In Africa, it's one of the countries which has been affected by AMR as well. We are much, much worse than other countries. So we call on patients, caregivers, advocates, and patient organizations to have a goal so that we must present the effectiveness of antimicrobial medicines for as long as possible. We want a world where human-induced antimicrobial resistance is eliminated. There is a global patient alliance which was formed around 2021. IAPO and through the Patient Observatory formed this patient alliance, and we have a global advisory group towards that AMR Global Patient Alliance. In Africa, we have also formed an initial Africa AMR Patient Alliance. We've done that considering the gravity of the situation in Africa. We are in the formative stages of the loose alliance, so that we should move on and see how we can assist in protecting and defending our antimicrobials. There is a global patient consensus statement and a call to action on antimicrobial resistance, which came out in 2021. And if you want to join the AMR Patient Alliance, that's the web where you can visit and sign up. But in addition to that, we want also this region to form AMR Patient Alliance. What is required is for organizations to express interest using that link so that one of the organizations can be a host to that regional patient alliance. So as we go to our countries, as we go to our respective places, let us remind ourselves that we have a call to action. We need to move. We need to be seen to work against the scourge which is with us, AMR. Thank you for your attention.